Hello, my name is Dr. Dewan S. Raja. Today I will discuss a few multiple choice questions from Neuroanatomy. So let's start our multiple choice question solving. So let's start from Q1. Question number 1. A 45-year-old anatomist has developed a meningioma of the olfactory group which compress the olfactory tract and the optic nerve, resulting in ipsilateral anosmia, that is lack of smell, optic atrophy, that will may lead to blindness, and contralateral papilledema, optic disc will be edematous. What is your clinical diagnosis? We have choices: Kluver-Bucy syndrome, Brown-Séquard syndrome, Wernicke-Korsakoff syndrome, Foster-Kennedy syndrome, Edinger-Westphal nucleus lesion. Okay, we'll go to the answer here. Okay, let's go to the next second question. Let's go there. A 45-year-old motorcyclist was involved in a road traffic accident during the bike week of Daytona Beach, Florida. The motorcyclist developed anosmia. Anosmia means lack of sense of smell, and CSF rhinorrhea. So CSF was leaking through the nose. It is coming out through the nose, certainly along with some type of blood, usually mixed with the CSF. Which of the following bone is fractured in that scenario? Is it temporal bone, parietal bone, occipital bone, cribriform plate of ethmoid bone, scala turcica of the sphenoid bone? Okay. Then our next question number, probably question number 3 will go there. Here, following a temporal lobe surgery for epilepsy, a 41-year-old man developed placidity. That means he is very docile now, very docile. Hypersexuality, hyperphagia, eat too much and in like to involve in sexual activity more than normal, and psychic blindness, there is visual agnosia. What is your clinical diagnosis? Foster Kennedy syndrome, Kluver-Bucy syndrome, Gilles de la Tourette syndrome, Wernicke-Korsakoff syndrome, Brown-Séquard syndrome. Okay. Then question number 4. A 44-year-old man has a long history of chronic alcoholism. He presented with memory disturbances and temporospatial disorientation. Okay, so these people has memory disturbances. They may fabricate some story. Okay, they have confabulation and temporospatial disorientation. Which of the following part of the brain is damaged in this patient? Hippocampus, singular gyrus, mammillary bodies, amygdaloid nucleus, caudate nucleus. Okay, what is the answer? We'll find out that. Question number 5. During a viva examination or maybe a job interview, an external examiner wanted to know the name of the nucleus that give rise to general, visceral, efferent, preganglionic, parasympathetic fiber that terminate in the ciliary ganglion. From ciliary ganglion, we have postganglionic fiber that will go to the ciliary muscle and the sphincter pupillary muscle. What is that nucleus of the midbrain? Is it red nucleus, oculomotor nucleus, Edinger-Westphal nucleus, lentiform nucleus, caudate nucleus? Okay, we'll find out that. So these are the answers. Let's get the question from the very beginning. Okay, if you go there, question number 1, meningioma of the olfactory group, which compress olfactory tract, optic nerve, resulting in ipsilateral anosmia. Person has lack of sense of smell, optic atrophy, contralateral papilloedema. What is the diagnosis? Should be Foster-Kennedy syndrome. Foster-Kennedy syndrome. Okay. Then cyclist has head injury and it involved the anterior cranial fossa, floor of the anterior cranial fossa, and the thinnest part is the cribriform plate of ethmoid bone, and that bone is the route for the olfactory nerve going from the upper one third of the nasal cavity to the olfactory bulb. Okay, so that is if that bone is broken, we'll have anosmia, and there will be damage to the base of the brain. So there will be leaking of blood as well as the cerebrospinal fluid. So which of the following bone is fractured? Answer should be cribriform plate of the ethmoid bone. Okay, we got that. Now, following a temporal lobe surgery, what happened to this 41-year-old man? He developed docileness, hypersexuality, hyper eating attitude or eating too much, and psychic blindness. Answer should be Kluver-Bucy syndrome. Kluver, you have to spot here over U, Kluver-Bucy syndrome. Okay. So we go to the last question, question number 5. During a viva examination, an external examiner is wanted to know the name of the nucleus that gives rise to general, visceral, efferent, preganglionic, parasympathetic fiber that terminate in the ciliary ganglion. So from we'll get postganglionic fiber that go to the ciliary muscle for accommodation, and also for light control, it should go to the sphincter pupillae muscle. Okay, what is the nucleus? There is the Edinger Westphal nucleus. Okay, so we got the answers, and that's all about these 5 multiple choice questions. In neuroanatomy, there is often asked in the exam, your board exam, MCQ, in your fellowship exam, or in your USMLE. So if you like my video, please support my channel. Please share the information with your friends, and please subscribe me. And have a nice day. Bye now.